They're incredibly convenient. Smartphone apps are awesome because I'm going to get up in the morning and I'm going to see how much I walked yesterday and how many miles I need to walk. For me, it's miles, how many calories I can eat. I'm going to look at my other app and I'm going to look at, my diet and keep track of that during the daytime. And because I have a chronic condition, I am often checking my electronic medical record online frequently because of prescriptions, lab results, notes from my physicians, or using it myself to do those same thing. And then also look up, I use other apps to look up medical information and also, read some comparative information on what maybe different, and I try to focus on academic centers are doing in the treatment of different. You really didn't have a way to, quickly get lab results, quickly get, prescriptions renewed. You didn't have to call into the office, all of those things took a lot of time. And I've been able to avoid a lot of what I would consider to be traditional office visits for things that were very simple, that could be answered through using electronic devices. And the fact that I can walk around with that in my hand at work. I travel for my business. It's awesome. I have, like many people, shifted from using primarily a PC to my smartphone for almost everything that I do. And I have grandkids, and if I didn't, they, I don't know if they'd even hang around with me anymore. And not every patient, particularly when we look at academic medical centers, lives right there. So where do I stay? Where can I park that's cheaply? All those things that may be more traditional now on websites, but they're not available on the majority of apps and integrated together. So it's a stressful situation coming up with a new clinical diagnosis of any type. So the more we can do sort of a one service for patients and think about that across the whole care continuum throughout all of the touch points. What do those people need, and how can we help guide them through that to bring it together? We in healthcare are very much focused on one point of care, whether that be the hospital or ambulatory or wherever. I personally have had about 17 patient appointments in the last 6 weeks. And if I didn't know where to go and what to do, particularly with some things that 3 times took me into the hospital, it would be extremely overwhelming for me and my family.